welcome everybody. Please mute your phone so we have a minimum of noise, including our front desk with Eduardo. Please, could you please lower the volume so it's less interference with the recording. Okay. So after those logistical items, and please, Eduardo or David, please admit individuals as they come in to the waiting room. And now let's proceed. So making sure that we are recording the session as well, David. So we have the agenda. This is my, a commemorative meeting for me. 1 year ago this month, I started this virtual sessions as a follow-up to the earlier director's work with the partnerships. And I know that they were face-to-face meetings. Because of the pandemic, we changed to virtual and has been like that ever since. So I really appreciate all the support that other organizations have provided to CVCC. And I will give an example of a collaboration that we were able to support another partner servicing the community, Rising Together. I will give you some quick updates with some organizations. There's a lot of hiring happening, and we will be uploading the brochures, the flyers that these organizations have shared with us, so you can download them from our webpage. And we have a lineup of speakers that will include members of our steering committee with that later on in the call. So please put yourself in mute and let's begin. So as many of you know, and for those that are new to this group, we welcome you. This is the Chula Vista Collaborative, and although we focus on the health of the community in Chula Vista, through this collaborative work with the partnership, we have a broader reach and impact across the county. We value that a lot. And please, I invite you to write in the chat box your name, the name of your program or organization, and contact information to communicate amongst each other, especially those that have the team platform. You're able to come back to the chat as it gets recorded also on the Teams platform. I do want you guys to interact, and hopefully pretty soon we will be able to have a meet and greet in person. Our family resource centers have been open during the summer break, and we continue to be open, especially now that our Chula Vista Elementary School District and Sweetwater Union High School District is also opening. And we have 5 locations across Chula Vista. You have, I welcome you to visit our ChulaVistaCC.org so you get to know more of our staff who is there at those family resource centers working for community. So as I was indicating a year ago, the landscape has been changing with cross-sector partnerships. I'm very proud to see the flexibility of our workforce that comes with challenges, right? Because we have had to implement a lot of cross-training, of flexible schedules, working from home, working at the offices, and also working a lot to improve our digital literacy, not only for our clients and assisting them in becoming more comfortable using technology, enrolling in telehealth, providing assistance for them to feel and be part of this digital boom using Zoom and other platforms for communication, WhatsApp, maximizing the use of their smartphones to become very involved with their healthcare and social services, but also of our own staff. And with a collaboration with the San Diego Futures Foundation, we are able not only to access better technology to do the work, but also the technical assistance that they provided us and our promotores in increasing our digital literacy. So overall, staff and clients can benefit and improve on those skills. We have continued with collaborations and on knocking on different doors. And I welcome you to consider a partnership and collaboration with us. And please send me an email, brendali.rodriguez@cvest.org for further talks. Our family resource centers are here for the community, and not only in Chula Vista, but we can provide technical assistance with other groups as well, as we are moving towards the recovery and rebuilding with the pandemic. Yes, we did support our partners, member of our steering committee as an organizational representative, the SBCS youth program that they held for months at the San Diego Convention Center, and we provided over 650 hours of staff in support of their activities. And there's the link there for you to know more about this growing organization that recently changed name. We also took a moment to kind of renew in our commitment in the team building, as me as a new director with the staff, that we have engaged mostly virtually and sporadic one-on-one visits and conversations. But finally, we had a chance to not to talk about work, just enjoy ourselves and gather and break bread, as they say. Because yes, it's an important part of servicing, addressing our own mental health needs, so we are stronger in servicing our families. And then there is this revitalizing energy in the air with many organizations hiring, including us. We are hiring for the family engagement specialist position. So send us an email with a referral or yourself expressing interest. Other organizations that are hiring as well, there is an event happening, I think it's tomorrow, but we will upload the flyer. We sent it via the listserv, and you can connect with Carol Crisp regarding this child care specialist and employment training positions available. Also, the YMCA is reporting that they're hiring, and specifically with the child and youth development team, and even there's a signing bonus. We have a flyer that we will upload with the materials from this call. And finally, we also received notice that Liliana Osorio from Champions for Health, and you can take a look at their website and see the positions available. They are hiring promotores and community health workers, and that is a group that we encourage a lot of capacity development, professional and workforce development, because this is a group that has been recognized at the federal and state level for their commitment and work on behalf of communities across the nation with the impact of COVID and directly working on the front lines. So more information on those positions for community health workers, bilingual, most likely, right? Liliana Osorio. Oh, you're here. And those are kind of just a sample of many of the organizations that are hiring now. So that is a fantastic opportunity for you to continue serving the community. And please feel free to incorporate your comments in the chat box. Right now, I'm going to end the show. Well, let's list our presentations by partners. So today we're going to first start with an overview of the Script Health Services with Dr. Kendra Brandstein. She is part of the CVCC Steering Committee as an organizational member. We're also going to hear a little bit more of the Blue Shield Promise Health Plan with another partner, and the speaker today will be Sean O'Brien. And later on, we're going to have two important topics related to COVID. One is related to pregnancy and breastfeeding. And through our wellness calls with the families in our school districts, we hear a lot about some of the concerns, and this presentation will address some of those questions. So please feel free to ask questions in the chat box for the speaker on COVID vaccinations, pregnancy, and breastfeeding. Another COVID and pandemic related topic will be brought to us by Dr. Gabriel Wagner on the importance of sexual health and protecting ourselves. So without further ado, let me get out of the slideshow and be able to present and leave the floor for our first speaker. Dr. Kendra, hello, good morning. Do we have you? So probably, well, we can move her to a second speaker. And I do see that we have right now on the chat and as a speaker, we have Sean O'Brien. Sean, am I pronouncing it right, Sean? You're muted.
There we go. Can you hear me now? All right.
Yes, yes, yes. Thank you for being here today. Do you mind being
Sure.
the first speaker in the lineup?
Yeah, so good evening, everyone, and thanks for having us. I also want to say that I'm going to be doing a sort of a joint presentation with Ale Ricardes, who's also on the call. So I'll talk a little bit about Blue Shield Promise at a high level in terms of who we are as an organization, and Ale will go into more specifics about some of the work and activity we're doing in San Diego. So with that.
Okay, so let me say, we have 15 minutes per speaker and question and answers. Just let me know next slide and I'll move them along.
Quick, so next slide. Yeah, go ahead and there we go. Yeah, this is just what we're going to cover today, so you can go ahead and move to the next slide. Great. Yeah, so those who may not be familiar with Blue Shield and Blue Shield Promise, so we are one of the Medi-Cal plans in San Diego. We also operate in Los Angeles, and we offer not only commercial coverage, you probably are aware of outside of Medi-Cal, but we have been offering Medi-Cal and CalMediConnect in San Diego for now about 2 years. I should also say that Medi-Cal is somewhat new to Blue Shield Promise. We acquired Care First Health Plan 2 years ago, so you may be more familiar with Care First. They were a health plan in San Diego and LA, and then through that acquisition by Blue Shield, that is what brought us into Medi-Cal. And since sort of bringing the Care First plan and membership into the Blue Shield fold, and bringing it into the Blue Shield family. So, but now Care First is in the past. The plan that we offer is we have a sort of a special name under Blue Shield for our Medi-Cal plan. We call it the Blue Shield California Promise Health Plan. So it's a sort of a subsidiary of the larger Blue Shield organization. So that's who we are. So go ahead, next slide. For those who may not be aware, we are technically a nonprofit health plan, which is a little unusual because most of the plans that operate in the Medi-Cal space are for-profit public companies. We're not for profit. What that means is that we don't have shareholders. There's no Blue Shield stock. So we really are here to serve our membership to really do the best we can to serve the communities that we operate in. The other thing that, because of our nonprofit status, we have, may or may not be aware of this, but call our 2% pledge as a nonprofit organization. So what that means is that we've committed to limit our income as an organization to 2% of the revenue that we bring in. And then anything in addition and over that, we reinvest back into our communities, back to our membership. And happy to say, it varies from year to year, but, in some years we reinvest back, close to $20 million. When we started with our 2% pledge, since it began, I think we're close to now having invested almost $600 million back into the community and back into our membership, members that we serve. So we're very proud of that. And then just to give you, again, a little high level sort of overview of our approach. So, we really value and, what we consider our member first philosophy. And, everything we do is really, with, our members really top of mind. So when we are pulling our network together of providers and hospitals, we really want to make sure that it, meets the needs of the population that we're serving. Because Blue Shield historically has been more of a commercial health plan, it's really driven us now that we're, serving Medi-Cal to sort of relook at the network of providers that we have to really make sure that it includes all the, community clinics, county health systems, safety net providers that are important and that serve this population. So, we're proud that, we have been able to sort of fine tune our network to really match the needs of, the Medi-Cal population. We also, knowing that this is a multicultural, linguistically diverse population that we serve, we really want to make sure that our operations, our teams, the way that we serve our members is both culturally and linguistically appropriate. Knowing how important that is, and to be successful, serving this, the Medi-Cal population. And then lastly, want to make that the other last bullet point on that was just again how we are, it's important to us to really invest in the communities that we serve. So we don't only want to provide healthcare to our members, but we want to really invest in the communities in which they live. A lot of that 2% pledge that I mentioned, the monies that we reinvest back into the community helps us to do that. Really helps to fund programs, initiatives in the community that would be of value to our population. So with that, I think we're going to transition now to Ale, who will talk a little bit more specifically about some of the community engagement work we do in San Diego and some of the ways that we really try to get engaged in various communities, Chula Vista included, and talk about some of the programs, initiatives, and activity that we're doing to really invest in the community and partner with the community. So with that, I will turn it over to Ale, who will go into a little more.
Thank you, Sean. Good morning, everyone. Buenos dias. Thank you so much, Brenda Lee, for giving us this opportunity to share about the work that we do in the community. Next slide, please. Okay, so as Sean was saying, today there have been $6 million invested in the community. So how do we do it? We invest to foster access to care. Mental health has been at the core of a lot of the work that my team does. I'm one of 2 community engagement managers that is driving the priorities, including mental health, equity, and safe spaces in the community. Social determinants of health, too, has been a big umbrella in terms of the programming and the support that we bring to communities. That includes substance abuse treatment, housing security, food security, and through alignment with our other programming, including our foundation as well as corporate citizenship, we also bring programming that addresses domestic violence other issues. One of the big programs that is part of our corporate citizenship in Blue Shield is our Blue Sky program. It has two main goals: increase access to behavioral health and develop I'm sorry, I'm getting a chat here. Access to mental health through schools and increase awareness and advocacy for behavioral health. We are present at 11 schools in San Diego where youth, high school students can access behavioral health directly. And that is a statewide program. Blue Shield recently, knowing that there is a lack of diversity in the mental health field, awarded $500,000 to increase mental health diversity in the mental health field. Those are the ways that we are investing in our communities. Next slide, please. Next slide, please. Thank you. Our membership in San Diego. To date, we have approximately 105,000 members. 103,000 of those members are Medi-Cal, and 2,500 of those members are enrolled in our Medi-Connect plan, and we're growing. But those are the overall numbers currently in the market in San Diego. Next slide, please. More specifically, in San Diego, last year and currently, 1.24 million were provided to the community in San Diego across different community-based organizations and community health centers. Our FQHCs receive some of the funding to address the many challenges and opportunities to as well to come together as a community in addressing the very challenging issues that our community faced throughout the pandemic. We also work with the County of San Diego to implement a very innovative program called the San Diego Care Coordination Project. I'm sorry, the slide is coming up. More specifically, as well, we provided $50,000 throughout San Diego, or through the San Diego Foundation, through some of our organizations, specifically addressing COVID and food security. Specific organizations that we work with that also received the funding are Hands Working Together, Hands and Hearts Working Together, which is an organization that does amazing work in San Isidro. We also provided funds through O2 MAC project. And there is another organization as well in Chula Vista that received funding for food security. Currently, we've also provided $25,000 for back to school events to a wide range of organizations, such as San Diego, your own Chula Vista Collaborative, and many other organizations in the community. Next slide, please. Again, the Blue Sky initiative addresses mental health. We are coordinating with them to work in our in the schools. Again, they are present in 10 different schools. The schools that they are present in San Diego are the Sweetwater Unified, Oceanside Unified, and San Diego County Office of Education. So far, when we run the data, there were had been 2,400 appointments or visits had been provided to you through the Blue Sky program, and it will continue to provide access to mental health in San Diego. Additional local support in the community in terms of the work that I do, again, we has focused a great deal in the issue of mental health. In early 2019 and during the past year, we have developed a really innovative community engagement model through our community resiliency work group, which is a group that brings 30 different community-based organizations to collaboratively create initiatives to address youth resiliency. We conducted, as part of that effort, youth conversations with 200 youth and are developing a social media campaign to develop awareness about mental health in a very, Sean said, culturally responsive way. This is a very project that is owned by the different organizations that are part of this collaborative, and we have an amazing group of folks that is part of this effort. We work with local elected officials through our stakeholder team, and as part of that effort, for instance, we signed a Racism is a Public Health Crisis letter in support of the initiative coming from the Board of Supervisors and all the elected officials. Again, supporting local efforts such as backpacks is very much at the core of a lot of the work that we do, especially during this time. We last year and this year gave away 9,000 backpacks to youth in San Diego. We are also leaning in very strongly through our virtual online forums. We have focused a great deal on the issues that are impacting the Black, Indigenous, and people of color youth community. We conducted an amazing forum last month that addressed the importance of providing culturally responsive and aware services to the BIPOC youth throughout Southern California, specifically in San Diego. Some of you might have attended, and we will continue to address these issues. It is the very core of our organization to bring services that are designed with our members in mind. And we know that language and cultural responsiveness is incredibly important. So we're driving that in the community. Next slide, please.
5 minutes.
All right. That's where we have been. We've been driving programming that focuses on social determinants of health, food security, housing, homelessness, health equity through our virtual programming and our relationships with community-based organizations. We're definitely framing the work that we do, knowing that we have a long ways to go, but we're here showing up with the community and driving health equity across our programming, including our community engagement. Again, mental health has been a big driver of the work that we do, and it shows up in our forums, in our in partnerships and internal community or Blue Shield owned programming, which is the community resiliency work group. Where are we going? We'll continue to drive mental health equity and social determinants of health through the work that we do with the community resiliency work group. We are planning to launch an Our Resiliency initiative in partnership with those community-based organizations as well as local city. We have had conversations with city officials in the city of Chula Vista. We are also building a participatory model that is part of this effort, developing a youth advisory committee, working with those different organizations. We'll be working with those organizations to offer ACEs training to providers and CBOs and working collaboratively, because I'm aware that there's a lot of work that's already happening in that field. So we'll be working with those folks that are already leading that work in San Diego. And really taking what we've learned to develop stronger culturally responsive programming that is meaningful to the community, that brings value to the community, but it also centers the voices of our members in terms of the work that we do. And I think that said, we'll be happy to take any questions at this moment. Thank you. And that's our contact. Feel free to email me if you have any questions about the work that we do, if you think we can partner in terms of The core areas that we tackle: equity. A lot of things fall under health equity, as well as social determinants of health and mental health. Do not hesitate to reach out. I work jointly with Patricia King. She covers the north and east areas of the county, but I'm your person if your organization works in the central as well as south areas of the county. And those are our primary numbers for member services, Medicare, CommuniConnect, and Medi-Cal. And we'll be happy to take any questions. Thank you.
Thank you so much. Let me end the show so we can see each other's face a little bit. And please, let's raise questions for our speakers. We have an open hand. Let me close here so I can read the chat. I have here a hand raised by Daniela Murphy. Welcome to your question.
Oh, I'm so sorry. I think that may have been unintentional. I apologize.
Okay.
Sorry about that.
No worries. So tell us, well, any other, let me see in the chat box if there's a question for our speakers, either Sean or Allen. I'm reading. I love that you all are putting your information, contact names, links, phone numbers. This is the purpose, the whole purpose of these monthly calls and hopefully incoming face-to-face meet and greets. All right, so looking at our agenda again, we have, I think I saw Dr. Brandstein. So let me pull up her presentation. She's gonna give us an overview of the script services. Let me find her. Okay, here she is. And I will share back my screen. And I hope that David or Eduardo are connecting and checking our chat box and bringing it to my attention. Okay, let's share. And I have Dr. Brandstein.
Can everybody hear me? With a mask and all?
Yes, yes.
Okay, good.
So you have 15 minutes, Dr. Brandstein, and I am going to give you a 5-minute warning, and just let me know next slide, and I'll forward for you.
Okay, but before I do that, I've presented in a variety of occasions to this group, and I'm enthusiastic to be here, so thank you. But I just want to take this opportunity really quick. I know that that all of you have gotten to know Brenda Lee really well. I'm actually one of her steering committee members, part of the CVCC, and I always like to take this opportunity just to congratulate her. I think she's bringing us together in new ways, and I want to just give her a round of applause. Because we don't get to do that in person. We always did that for Margarita when I got to present. So I like to do that. So thank you, Brenda Lee, for your continued work in this area. It's really important. Good. You can, next slide. So this is our building. We're just a couple blocks from the hospital. For those of you that don't know where we're located, we are part of Scripps in Chula Vista, connected to the hospital here. And some people don't know that that Scripps in the community in the South Bay here does more than just take care of patients. Right now, COVID patients are really high in our hospital, and our healthcare workers are working really, really hard. We continue to be able to do the prevention and other work. Next slide. Just some of the areas that I'll touch on today. You know, this presentation would take a lot longer than I have to present to you, so I'm just going to touch on some of our work around our Area Health Education Center, our patient care transitions work, some of our work around cardiovascular health and our breast cancer outreach, women and newborns, and some of our senior work. Next. All right. So many of you know that we're running and we're partnered with a family medicine residency program. For those of you that want to become doctors and work in the community, this is a wonderful program. Most of our doctors actually grew up in this community, went off to medical school, and then have come back to practice in the clinics. We've got 3 resident graduates who are actually running some of the local community health centers. So for example, San Isidro is Dr. Carriedo. She was an early graduate of our program. So what's cool about it is that our local docs are from the community. They speak the language of the community. They look like our community. And we're really proud of the work that we're doing with our residency program. So for those of you that want a second career, come on board. Or are thinking about this. Next. So one of our claim to fame right now is around our youth programs. For the last 20 years, we've been hosting a wide variety of mentoring, health professions 101, surgery viewings, camps, and we have 2 school-based clinics that we're working in. And so a variety of programs are going on with youth, the whole goal being to inspire the future generation of health professionals. Some of the nurses and doctors want to retire someday, and so we really do need to build that workforce. And the exciting thing is that it was a struggle at first to go virtual. We've been 100% virtual since COVID hit. All of our programs have become virtual, and we just finished a summer camp with 24 kids from the Sweetwater Union District, and they did a great job. They got a stipend of $500, and they were really enthusiastic. And I think we're building our pipeline slowly for these health professionals. Next. And you can just see, again, everything's gone virtual, including the surgeries. We used to be able to see surgeries actually in person live, and again, that's virtual as well. So just really quick, with our youth programs, we also have a fairly large internship and scholars program for those interested in either public health, social work, or careers in healthcare. Next. So some of you may or may not know, hopefully you haven't gotten a call from us before because you've never been in our hospital, but if the day arrives and you are in our hospital, we do offer supportive services as much as we can for patients that get discharged. These are just some of the services that we partner with other organizations or we actually help. Next. So we're really focused on patients that come in with specific diagnoses. So if they come in with a heart attack, COPD, pneumonia, hip, stroke, or COVID, my center will actually reach out to them and help them, connect them to services like yours, and make them feel connected beyond the hospital walls. So the other thing I want to say is that while we're focused on specific populations, if you're ever in the hospital, please, if there's something I can do to help you navigate, I can't do it for all 5 hospitals, but I can do it for the hospital right here. So I always say that during this presentation. Next. And this is just some data that shows who we're reaching and who we're not reaching and services that we're providing. Lots of emotional support, as you can see. Next. Next. The other work that we're doing is around chronic disease, and we continue to do most of this virtually. Although the good thing is that the stroke support group is actually going to come back. We're going to actually meet in the back of the center and do that in person. It's been really challenging for some of the support groups to meet virtually for a variety of reasons. So we are slowly bringing back and with masks and outside some of these support groups. Next. This is one of our heart programs that we're running in the community. It's been virtual. We'll continue to do that as much as we can. Next. Next. And then the breast cancer support group is probably one of the most enthusiastic groups that we have going on here. There's about 24 women that are cancer survivors that get together regularly. They are meeting in the park. They meet sometimes twice a month or once a month. And it's really a supportive environment for people going through cancer, especially women. Keep going. Next. And these are just services that we offer. We have wigs, we have a whole bunch of stuff for people going through cancer treatment. Next. All right, and then we also are running a variety of maternal and child health programs. We've actually partnered the last year with Grossmont College to offer virtual classes for foster parents and adoptive parents. And we work together with our family medicine residents. Some of our doctors do that together with us. It's a really nice collaboration. We also do newborn home visiting and continue to do some of the maternal and child health classes. The breastfeeding support group has been done online, virtually. It's been a struggle. We're hoping to get them back. Next. All right, and our senior programs. So the senior programs have been probably the most challenged. We continue to reach seniors. We've been doing it virtually with them, and it's been challenging getting them together. Although the place that we work with, which is St. Charles Nutrition Center, they have had people join our chats. It's just not the same. Seniors are very isolated. And we're hoping to get back at some point to being able to at least present to them in an environment that's safe for everybody. And working with Brenda Lee with some of her expertise also in the technology end to help support the seniors. Next. All right. We also have, again, these are just some data around the seniors. You can keep going. I don't think they need to do the data exactly, right? So we continue to work. We've done some trainings with the ChulaVistaCC for promotoras around COVID, and these are virtual. We'll continue to do education with promotoras, and South Bay Community Services just got some funding around education for promotoras, and Brenda Lee, we happen to be a part of that. Which is new, so hopefully we'll learn more about our role there. But you can go to the next slide and see some of the, we call them Meet the Doc sessions that we've done with ChulaVistaCC, and hope to do more of this with the local promotoras in the area and address some issues that are still present and could be answered by a local doc who can be really helpful and supportive. Next. All right. And that's, you can scroll through. This is just some of the outcomes. Next. All right, so this is our location. I'll put in the chat box my email address, but just in summary, I'm hopeful that if there's opportunity for us to partner, if there's opportunity for us to work together, I'm always open to joining in a proposal to helping strengthen whatever you're doing. I love that, and I really enjoy when we get that call to do that. So, and we will hopefully get to know you as well. And if there's something we can do to support you, again, not just in the prevention and wellness work we're doing in the community, but if there's a loved one or you happen to be on the 3rd floor in our hospital in Chula Vista, please reach out to me. Okay. Thank you. I hope that wasn't too quick.
I'm going to close your presentation here and allow the floor if there are questions for Dr. Bernstein, please.
If there's no questions, it means nobody was listening.
The what?
If there's no questions, it means no one's listening.
No, I mean, when we started the call, I mentioned that, yeah, we will be having in the speakers line a member of our steering committee, and that is not a light title. We do look for opportunities to strengthen connections and provide technical assistance or advice either way, in either direction. I think that the work needs to come as collaborators, and in that spirit, I think that a lot can be accomplished. We have worked with you in the past, and now under my leadership, we plan to do more. Indeed, education, prevention, and for the community health workers to make that bridge, addressing the gaps in service and disease maintenance and management for treatments and the like. I think that is very promising, as a lot of data is coming from different corners of the nation on that respect. So definitely we want to continue working with Scripps and with you specifically, Dr. Bernstein. Thank you.
Good. I was making a joke about not listening. I teach a course at the university, and I always tell my students that if I don't ask questions, it means they're not listening. But that's a joke. Don't take that personally. I want to share, just to respond to one of the questions. So our youth, I did forget to say this, but because we've had a lot of time, we've got a lot of students involved in our work, we've got a lot of residents, we've actually built a really wonderful library of resources around webinars and curricula for youth, as well as seniors. And so I open this up to you. If there's a topic that you would like to have a presentation on and you want to use it for whatever you do, it's open for you to do that. You just need to tell me the topic, and anything from the ACEs work that we're doing to mental health, to suicide prevention, to what have you. I mean, it's a wide variety of topics, some healthcare, some social work, some public health stuff.
Yes, and we have had some of your recommended speakers speaking directly to our community referral specialists regarding COVID and long-term. So we really appreciate that assistance along the way. Here I'm reading out some of the comments in the chat regarding our presentation. Thank you, Dr. Bernstein. And there's a question here. Is Meet the Doc sessions where topics of community health are shared with doctors? This is Debbie.
So the Meet the Health Doc sessions are actually for the community, presented by the physicians. But we're happy to share what the physicians and my team have created. They may be useful for patients and could be used in physician offices, if that's the question, if I'm responding correctly to the question.
Okay, do you have more information on parenting classes?
I do. We have a lot of classes through Grossmont. I can share what's upcoming there and how that works, especially if you're a foster parent or an adoptive parent. We can share that as well.
Yes, and if you send it to later today, but I think it's also what Portia sent me, Portia Smith, then
Yeah.
I will include those in the materials to be uploaded starting tomorrow onward, so we can upload this recording, the slides, and the flyers.
Right.
Fantastic. Now there's, let me see if there's another question. We have more minute. Oh, you have here interest from Debbie Daniel indicating that she's interested in foster parent training curriculum. Please add your contact information in the chat so Dr. Bernstein can follow up. Also, if you are part of Teams platform, all the comments in the chat box get recorded and available for later access.
And I sent my email there, so everybody should have my email.
Fantastic. That's an opportunity to connect with you later. Let me see.
There is a representative on the call from Grossmont. I know that Daniela, who just asked a question. So, she also can be supportive on how to access the Grossmont College classes.
And last question is gun safety and safe storage something that would be appropriate to include in the foster parent training?
Absolutely. Absolutely. I love it. I'm going to write it down right now.
Don't wait
I
for the
love it.
recording, right? Write it down
I'm
now.
writing it down right now.
Fantastic. Thank you so much again. Thank you for your service to CVCC as part of the steering committee and all the linkages that you support. And right here we have our next speaker.
Thanks,
And
Brenda Lee, for all you do.
yes, thank you. I know that we're pressed with time, but I do want to give honor to the two other speakers because these two topics are related to COVID, and I know that we may feel that, oh, overwhelmed related to COVID topics, but it's necessary. We have so many dimensions that we aim to cover, and now more and more knowledge is being gathered, emergent, and it needs to be shared. Right now, we have the Mother to Baby program, and Angela Messer can tell us more about the vaccines in pregnancy. Let me put this on. Oh, first of all, I need to share again, right? And sharing the screen, and now getting the presentation ready. Again, 15 minutes, and I will give you a 5-minute warning and can send forward the slides. So thank you, Angela.
Good morning. Can everybody hear me okay? All right,
Yes.
Perfect. So I will try to go through this not too quickly, but quickly enough so we can save some time. If anybody has any questions, I'll take a look at, afterwards. So my name is Angela Messer. I'm with Mother to Baby California, and we're housed out of UC San Diego. Next slide. So just in case people aren't familiar with us, we are a resource. We're on the CDC, FDA for the approved contact for information on exposures and medications in pregnancy and lactation. And as you see on the bottom, as of March 12th, we were added to the CDC website under COVID and COVID vaccines for pregnancy and breastfeeding. So we've been quite busy with chats and calls all over the US. And territories. So we are pretty up to date on all the information. So I'll kind of go over that right now. Next slide. So you guys know a little bit, obviously, about COVID. We talk about the symptoms. They're typically, for the latest data, they're not different in pregnant people. So the reports and the studies have not shown a difference in side effects if you're pregnant or not pregnant. Those are the typical symptoms you see here. And then at the bottom, you'll see the new Delta variant has been reported twice as contagious as the Alpha. And to date, the states who are reporting have reported less than 1% breakthrough infection if you've been vaccinated. So these are states including Alaska, California, some of the Midwest states, but not all states are reporting. So we definitely need that data to see, be more accurate. But overall, vaccination is key, as we all know. Next slide. So in pregnancy, you may have seen these increased, the groups that are increased risk for severe illness, and pregnant and recently pregnant people are in that category. So we have a lot of pregnant people planning pregnancy, speaking with us about that. They are at increased risk for hospitalization, severe illness from COVID if they were to be infected. Also, underlying conditions on top of that, as we know, pregnant people can have diabetes, other chronic conditions or illnesses, and age over 25. It's actually changed from the 30 to 39 age group. So we're seeing this in younger pregnant people, unfortunately. And also just considering, people are returning to the office, and we're getting a lot of chats and calls about mandating the vaccines, even in pregnancy. So a lot of inquiries about that. We can kind of touch on that a little bit later too. Next slide. So far, the data has not shown an increased risk for miscarriage or birth defects if a pregnant person were to contract COVID. So that's reassuring so far. However, what we have seen is the increased risk for preterm delivery, preeclampsia, increased risk for placental complications, which can then lead to the increased risk for growth issues and emergency C-section. So these are all these things we've seen with the pregnant population. And we get a lot of questions about long-term effects with the COVID vaccine, but obviously that's not available since the vaccines have just come out in December. So more research and more time, but based on what we know about other vaccines historically given in pregnancy, we wouldn't expect there to be any long-term issues. Next slide. So we know fever can be a possible symptom, and high fever untreated in pregnancy in the first trimester has been associated with an increased risk for neural tube defects. So that's something that we discuss with people that call. If you were to get a fever, typically Tylenol or acetaminophen is recommended. Check with healthcare provider, but as long as it's treated, we aren't aware of that increased risk. And having COVID can increase a chance of blood clotting issues. There's been studies of women who are giving birth in hospitals, and they've had this higher chance of blood clotting and heart attacks with women who didn't have COVID. So this American Society of Hematology recommended all adults, not just pregnant people who are hospitalized, be given the treatment for blood clotting issues just to remedy that and make sure that's not an issue. Next slide. And reassuringly, most newborns have not have evidence of infection at delivery. So there have been some reports, but overall, we don't think it's transmitting at delivery. We think that it's a person to person, that when they have the baby that it passes on, but it's very rare that we've seen these reports. And most infants who have tested positive have had only mild or no symptoms and fully recover. So that's reassuring as well. Again, these are based on the old variant or the first variant and not the Delta. So we might see this change, hopefully not. And then we get a lot of questions about antibodies. So we have seen some small studies that have reported antibodies in the babies whose moms have had COVID infection. So that's a positive, they're protected, but we just don't know how long that may last or how much they might be protected. Next slide. In breastfeeding, if a mom has COVID, the studies so far have not found it to pass through breast milk, which is also reassuring. So no cases of infants or babies getting COVID through breast milk. They have seen some particles of the virus in some breast milk samples, but they're not expected to cause infection. And in fact, again, the antibodies are found in the breast milk, so in some small studies, so that offers actual protection and not the infection. And they're encouraged to still breastfeed. It's very rare that we see any recommendation to not breastfeed. A couple small exceptions, but typically they will, still be recommended to breastfeed and nurse. Just masking, washing hands, washing parts if you pump, things like that. And yes, and again, while they recover, they just have to follow those protocols, and we typically haven't seen any concerns if those are followed. Next slide. So the vaccines, you guys everyone's pretty aware of all these kind of approved vaccines. We'll go over a little bit. The mRNA vaccines, they work on the surface of the cells and spike that protein. The ingredients of the vaccine are broken down in a matter of hours and days. So those aren't circulating in the blood, just spiking that protein for protection. So that's Pfizer and Moderna. Most of our studies in pregnancy are on Pfizer and Moderna, simply because they came out first. So Johnson & Johnson didn't come out till end of February. That's the viral vector vaccine that uses a harmless piece of the virus to spike the protein for the antibodies, which is the protection. So these aren't live vaccines. Live vaccines aren't given in pregnancy, like MMR, varicella. They're not giving us COVID. They don't interact with our DNA. So far, studies have been pretty reassuring. Next slide.
Yeah, this summary slide is very good.
Okay, good. I know we often need to explain the vaccines a lot, so I hope it's coming across okay, but I'm willing to answer any questions. So I won't read through all this, but this is kind of our latest data you guys can look at through. We have 2 completed studies. The CDC is the biggest one, of about 112 completed pregnancies. So remember, there's some women that are still pregnant in the study. They have to give birth, but so far we haven't seen any increased risk for preterm delivery, babies born smaller than expected, or neonatal deaths with these COVID vaccines while pregnant. And another study looking at about 60 women who received Pfizer after 26 weeks and found no increased risk for preterm delivery or complications. And again, no data on Johnson & Johnson as of yet, just because it came out a little later. Some of the women in that initial CDC study were in 1st and 2nd, but majority were in 3rd. They just happened to be in that trimester. But as more time goes by, we'll be able to follow those women who received it earlier in pregnancy so we can get more data. But so far, no increased risk that we've seen to date. Next slide. And no evidence that the vaccinations cause any problems with pregnancy or planning to. So if you're planning pregnancy, no evidence of fertility issues. There's no recommendation of when to receive the vaccine. So we have many people asking, is it better to get it later or beginning? You need to just get it when you can, because this is a pandemic and needs to offer protection. So there's no recommendation as of yet. Maybe once it's under control, there might be some recommendations later on, but for now, we just need to protect everyone from COVID strains. No recommendation for one over the other. You may all have heard about the Johnson & Johnson vaccine being pulled for a little bit. They found about 7 out of every 1 million doses given to this reproductive age population they had seen some blood clotting issues. So they pulled it, looked at it, realized it was very rare. The 7 people in 1 million is very rare. So they realized, this is something, unfortunately, just a rare thing, put it back on, still offered to pregnant women. You can still choose that if you're pregnant or breastfeeding. If you already have existing blood clotting issues, it might be something you might want to be aware of and weigh the risk and benefit and choose the other ones if you'd like, but no recommendation to not receive those. And then for conception, you don't have to wait to conceive for these. Again, based on how they work, they're not sitting in our bloodstream. They're spiking the protein. Antibodies are there, so there's no recommendation to not become pregnant right after. And then again, side effects, we know about those. They can happen after the 2nd dose, typically. And then again, if you're experienced that, you can take Tylenol typically. However, they don't recommend you take it before, just so you can let your body react as it should. Next slide. And then recently, ACOG and many organizations, actually yesterday there was a joint statement that just came out, and I can forward it to you guys, but there's about 20 healthcare organizations that are now recommending the COVID vaccine in pregnancy. So that's encouraging. So we like to see that, because before there was still this back and forth on the recommendations or if there's an official one, but now we have a lot of organizations on board. If you get pregnant after receiving the 1st dose, you still should receive the 2nd. And again, another positive with the antibodies, we've seen some reports of that also being in the cord blood of women who have had babies. So it's if you had COVID, it's there, but it's even stronger antibodies and protection if you've had the vaccine. So that's something to consider as well. Next slide. And just a kind of a rundown of people if they're kind of nervous about getting it, or they want to know, should I get it, should I not? We kind of went through the risks and benefits, but the known risks are if you have COVID, there's preterm delivery issues and severe illness, versus so far we haven't seen any increased risks with the vaccine. So these are just things to consider if pregnant people are having a hard time deciding, looking at where they're working, if they're home, but with this Delta variant, it's getting a little weighing more on the benefits side. So next slide. In breastfeeding, again, research is ongoing, but as we mentioned, some small studies have not found the mRNA from the vaccines in the breast milk. Only smallpox vaccine and yellow fever vaccine are not given in breastfeeding. So every other vaccine has been given. We don't expect these vaccines to be any different based on the way they work again. And the components, again, break down very quickly in the body, so they're not expected to get to the blood to then reach the breast milk. So even if some were to get in the breast milk, they're swallowed by the baby. They seem to kind of break down in that GI tract, so they're destroyed, and we wouldn't expect to see any issues with the breastfed baby. Next slide. And no recommendation to postpone breastfeeding or discard milk. We get that question a lot if they have to pump and dump or pump and discard. That's not recommended. And then, of course, the CDC and all these other groups are saying that if you are breastfeeding, you may choose to get any of the vaccines. And again, the reported antibodies that we're seeing in some women who've received the vaccine while breastfeeding. More studies are needed to confirm the timing, but another positive to protect the baby from COVID if you were to get the vaccine. Next slide. So these are just a list of the references, and I can give you guys any other info if you'd like. Next slide. This is very important, the VSafe and VSafe registry. You may have heard on the CDC. If you do choose to get the vaccine and you're pregnant or breastfeeding, it's important to report your vaccine to this registry. They ask you about side effects, and this is how we're getting this data. So really important. We encourage women to report that and to enroll in the registry. And the registry is actually where they collect pregnancy information. So that's how we're getting these, reassuring information about preterm delivery and small for gestational age. They get medical records from these participants. So it's very detailed pregnancy information, which everybody wants. And so we encourage them to enroll in that. And Mother to Baby is also doing our own studies. So just if they choose to receive the vaccine, we're really encouraging these people to enroll in these registries and studies. Next slide. So these are just our contact information for our pregnancy studies and our breastfeeding studies. We're housed, like I mentioned, through UC San Diego, and the pregnancy studies are with Mother to Baby, and we're under the Center for Better Beginnings at UC San Diego. And we also have our Human Milk Research Biorepository, which they're collecting information in breastfeeding as well. And this is just our contact information. We have counseling in English and Spanish, chat, text, email, and phone. So you can reach us pretty much any way besides smoke signal, but that's but every other way we're here. Next slide. And if anybody has any questions, I know I kind of went through that really quick, but I didn't want to lose time. So if you guys have any other questions later on, I have my email on the slide. You can contact me that way. Any updated information we also have on our website. We have fact sheets on COVID and COVID vaccines, and it's a great summary of the latest data and the references as well. So thank you guys for listening.
Thank you. Thank you for this presentation. Let me double check on the chat. I watched a webinar a few months ago that hosted experts discussing the vaccine for nursing and pregnant women. Since I'm still nursing, watching it helped me decide on getting the vaccine. Thank you for your work.
So yeah, it's still not official recommendations, so definitely up to you. But again, based on the way they work, they're not expected to get into the breast milk. So that's already reassuring. If there's no vaccine components, there's no ingredients that are reaching the breast milk, then we don't expect any adverse effects. We haven't seen an increased risk for things like milk production, the taste of the milk, anything like that either. So again, I think experts are thinking this is very similar with other vaccines received in pregnancy and breastfeeding. So we're not expecting there to be an increased risk.
Thank you. And just a reminder that all these slides with all those active links for all the presenters and accompanying flyers, we are going to upload them in our webpage for later access. I expect that by the end of the week, and that will be available with all those live links provided, resources and references. Glad that people are incorporating in the chat their contact info, program name, and other details of events. So again, thank you,
Thanks,
Angela.
everybody.
And now we go to our last speaker of the day with this lineup. Yes, it's on COVID. We have Dr. Gabriel Wagner, UC San Diego, and the topic is the importance of sexual health during the pandemic. Do we have Dr. Wagner? Hello.
Hello, can you hear me?
Yes, yes. So now that we have you here, let me share my screen. Or would you rather do the screen? I have it ready, and you
That's
can
fine.
yeah.
You can go ahead.
And just like with everybody else, 15 minutes and then a little bit of question and answer. Let me put this on presentation mode, and let me know when as next.
Okay, so thank you everybody for allowing me to speak today. Today I'll be talking about the importance of sexual health during the pandemic. You can go on to the next slide, please. So we can begin by talking about sexual health. So what is sexual health? The World Health Organization defines sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. And it is not merely the absence of disease, dysfunction, or infirmity. So this is important in the sense that the sexual health is part of the overall health of an individual. It's one of the dimensions of overall health, and it's a dimension of overall health that is often overlooked. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, including having pleasurable and safe sexual experiences that are free of coercion, discrimination, and violence. And this is important to understand that sexual health is part of one's overall health dimension, and we should be able to enjoy it thus, without experiences of discrimination or experiences of violence. You can move on to the next slide, please. So why is it important? It's important because it's part of your overall health, as I mentioned earlier. It's more than your sex drive and your libido. It's how you incorporate healthy sexual habits into your self-care routine. So you can think of sexual health in the same way that you think of other parts of your health, your visual health, for example. It's important that you go see an eye doctor once a year or periodically. It's important that you go see the dentist once a year or periodically. In the same way, you should think of your sexual health. It's important because it maintains healthy relationships with yourself and others, including your sexual partners, the doctor. And it allows you to take control of your health physically, mentally, and emotionally. And in addition to doing all of this, by taking care of your own sexual health, that actually helps to eliminate the stigma that is associated with STI and HIV by normalizing regular testing. Next slide, please. So what are the most prevalent sexually transmitted infections in San Diego? When I talk about STI, that is an abbreviation for sexually transmitted infection. So there are a lot of STIs, but the most prominent ones that we check for due to their prevalence in San Diego communities are the ones listed there. HIV is a viral infection that is transmitted sexually mostly and causes AIDS. It can also be transmitted through blood. Chlamydia is another sexually transmitted infection that is bacterial and treated with antibiotics. Syphilis is another sexually transmitted bacterial infection that is treated with antibiotics. Gonorrhea is another sexually transmitted bacterial infection that is also easily treated with antibiotics. And finally, we have hepatitis B and C, which are caused by viruses, the hepatitis B virus and the hepatitis C virus. Both of these are viral infections that are mostly transmitted through blood, but they can also be transmitted sexually. Next slide, please. Okay, so taking all of this into account, what does this mean for you? What does this mean for what you should do? How often should you get tested for STIs? So the frequency of testing depends on the person, depends on your age, sexual activity, and other risk factors. And below are, in the table shown, are some of the general recommendations. So one of the main risk factors is simply the amount of exposure that you have as a result of sexual activity. So the more sexual activity, the higher the risk of contracting STIs. So the higher the number of sexual partners, the higher the risk of contracting STIs. So for example, someone who is in a monogamous relationship, as you see on the table listed there in the top, monogamous relationship, someone like that needs to be only screened for STIs annually, or maybe even less, depending on the nature of the relationship. So, and you can see all the categories listed there for HIV, chlamydia, syphilis, gonorrhea, and hepatitis B or C. Now, if I am someone who has multiple sexual partners, so let's say, for example, in the last 3 months, I've had 10 sexual partners. Let's say, for example, that in the last 1 month, I've had 5 sexual partners. Then testing for STIs would be more frequent. It can be testing for HIV can be annually, and testing for chlamydia, syphilis, gonorrhea, and the other hepatitis can be every 3 to every 6 months. So I can gauge my own level of risk and decide what is better for me. And I can perhaps set up a standing calendar reminder to remind me to have testing every 3 months, or to have testing twice a year, and I can set it up that way. So, for example, if someone is now on the other hand is abstinent, so no sexual activity, then HIV screening should be done. Well, HIV screening is recommended for all adults at least once in the United States, but for the other STIs, if you're not having sex, then you don't need to screen. If you're having sex, oral sex only, then screening once a year. But if you're not having any sex at all, then you do not need to screen. Next slide, please. And so you can see, you can empower yourself by becoming aware of your level of risk and deciding how often to test. In addition to that, there are a couple of different tools that you can use to prevent STI and HIV. So one of those common methods is, as you see on the left there, the condom or barrier method. And remember that correct and consistent use of a latex condom is highly effective at reducing STIs, and it is recommended to use a condom every time you have anal, vaginal, or oral sex. In practice, we find that most people do not use condoms for oral sex, but using a condom as much as possible is advantageous and helps to reduce the risk of STIs. You can also reduce the number of sexual partners. As I mentioned earlier, the risk of STIs goes up with the number of sexual partners. The more sexual partners, the higher the risk of STIs. And just knowing that information, you can decide how best to go about it. You know, maybe for a period of time, you decide to decrease the number of sexual partners. Maybe for a period of time, you decide to only masturbate, or whatever the case may be. But this is something that you can use to gauge how you take care of your sexual health and how often you get tested. So getting tested for STIs and HIV regularly. And so just if you incorporate this in part of your routine, self-care routine, then this can be another added tool that at your disposition. And finally, another tool to discuss is called PrEP. PrEP stands for pre-exposure prophylaxis, and PrEP is a daily pill that can be used to help prevent HIV. So this is important because it's a highly efficacious method for preventing HIV. PrEP is indicated for anybody that wants to reduce their anxiety about getting HIV and want to be more proactive about their sexual health. And what's important is that all of the 4 tools that I mentioned here can be used however you want. You can mix them, you can mash them, you can maybe use one and not the other. You can use whatever works best for you to be the healthiest version of yourself possible.
5-minute
slide,
warning.
please. Thank you. So what are some of the trends that we have witnessed? So basically during the beginning of the pandemic, during the lockdown, we observed that there was a spike in STIs and HIV. And this probably had to do, in the beginning, you may remember that people were not able to go out much. So people probably couldn't get together. But then in addition to that, there was also a decrease in the availability of sexual health testing services. So now that has improved. And we do expect to see a spike in the rates of STIs. We had been seeing increasing levels of STIs previously, and we expect that the same thing will happen now. Next slide, please. And it's important to understand that some communities are disproportionately impacted. So gay and bisexual, Latinx, and Black men are disproportionately impacted. Younger folks are disproportionately impacted by STIs, as you can see in the top right. Young people are young people make only 13% of the population, but account for 62% of chlamydia cases. So the overwhelming majority of chlamydia cases are among young people. And as you can see in the bottom right, the rates of chlamydia are highest in the South Bay. Now, it's important to understand that a lot of this has to do not based on sexual activity, but rather on systemic and social barriers to STI preventive services and treatment services. Next slide, please. So here are some low to no cost sexual health resources in San Diego County that you can avail yourself of. One quick thing that I would like to mention is the Good to Go San Diego program at UC San Diego, which is where part of my work group. We have developed a tool that you can go to the Good to Go website. You can click on Do I Need an Appointment, and it'll point you in the right direction in 3 minutes. It's the best, the closest available testing services for you. Next slide, please. And I think that's about it. Questions, I'm happy to take them.
Thank you, Dr. Warner. Let me end the slideshow so we can all see and stop presenting here and share. Let's go to the chat. Here, Angela is sharing that if you'd like to receive free sexual health promotora guide, feel free to, and she provides her email and contact info. So thank you for that. There are more information sharing bits about pregnancy and about testing, HIV testing and STI. And anybody that want to raise your hand for a direct question to Dr. Wagner now? Well, I can spice things up. We have a donation for some e-gift card. So I have one question for the group. So be ready to write in the chat your answer, and the first one that gets the answer right will get via email a small e-gift card on this. And the question is, and please, Dr. Warner, stand by to elaborate more on the answer. So the question is, everybody, PrEP is a barrier method to help protect against HIV. Is that true or is that false? PrEP is a barrier method. Is it true or is it false? And I got the first one that got it. Oh, wow. So it's a mixed bag there. We have some people that think it's true and others that it's false. And the answer to that question, Dr. Warner?
I guess that would be false. Barrier method would be something that provides a physical barrier, like a condom. PrEP is a pill.
There you go. So to conclude, PrEP is a pill to help prevent HIV. Thank you. Thank you for that. And let me see who had the first answer right. That's Valerie. Okay, Valerie. Hey, so I'll communicate with you for you to receive the link to the raffle. So if your organization can provide also some of those electronic gift cards, we can spice things up on our incoming calls. Thank you to HealthNet to provide those raffles. We're going to use them for several of those calls. And I really thank all the speakers today, Angela, Dr. Wagner, Dr. Brandstein, and Sean and Ali Ramirez today for the conversation, the knowledge, the information, and all the attendees. We had a full house today, and I wanted to thank you for your support. Contact the people in the chat, myself at CVCC, and our next call, just a reminder that it's going to be on September 14. And with that, I am going to leave you. Have a wonderful, wonderful day, and be safe.